Hello, I'm Dr. Robert Warrener, Chief Medical Officer of Healogics.
And I'm Dr. Scott Covington, Executive Vice President of Medical Affairs.
We're pleased to present to you today a new tool that is designed to assist you in your daily practice at the Wound Care Center, as well as to talk to you a bit about our newly integrated company and what it is that we stand for. Healogics is the wound healing expert, driving wound science, wound healing, and wound prevention forward to help heal more wounds and to change more lives.
We are truly at an exciting time in the world of wound care. We're committed to advancing wound healing by creating, sharing, and activating wound prevention and care expertise wherever we can, for every patient who can benefit and by the best means available.
Together, through you, our network of dedicated physicians and clinicians, we're working hard to improve the lives of those patients who are affected by chronic wounds. We're combining the best medical practices and experiences of two companies. In response to your assessment of the limitations of the current format for presenting the clinical practice guidelines for wound care and hyperbaric medicine, we're introducing to you HealSource, a pocket version of the information contained in the nearly 300 pages of clinical practice guidelines, put into a more user-friendly and readily available resource for use in the wound care center environment.
HealSource is a concise reference for wound care and hyperbaric oxygen therapy. This handbook is intended to be a useful guide to patient care in the wound care center and is an abstract of key components of the clinical practice guidelines, a comprehensive, evidence-based practice manual for wound care and hyperbaric medicine, which is available on the Healogics intranet.
The information contained in this HealSource booklet is considered confidential and proprietary. Under no circumstances shall you copy, distribute, or otherwise make publicly available all or any portions of the HealSource booklet.
Please note that this is version 1, and we will be soliciting your feedback in reference to how you're utilizing HealSource and suggestions for improvement of layout and content. Electronic formats will be introduced in the near future.
We're excited to share the enthusiasm around our new name, Healogics, and what it stands for. We're committed to using the best available science as it relates to wounds, and with it, the power to heal.
We live by the power of our convictions.
That the status quo in chronic wound care is no more inevitable than it is sustainable. We can and we must continue to improve wound outcomes, healing more wounds.
That we have a responsibility to bring wound healing front and center, continuing to move it forward, not standing still at the margins of medicine.
That bringing together more people from more places can only help us in the fight for progress, connecting different medical disciplines, researchers, educators, and clinicians, patients, and families.
That we can awaken our body's innate ability to heal with a greater understanding of medicine and a rigorous scientific approach. That we will explore, we will test, we will find and develop new protocols and new pathways. We will seek out new technologies that lend to the healing of our patients.
That best practices are best shared to create a vibrant, connected network of trained professionals who are committed to advancing the field and the practice and helping people heal faster and more completely than ever before.
That a world where wound care and wounded patients are not marginalized is achievable.
That passion and performance make it possible. That together we can make people whole again.
Healogics.
Healing more wounds
together.